Postnatal anxiety is anxiety that's experienced in the postpartum period. Similar to postpartum depression, there are a variety of factors that we think may trigger anxiety in the postpartum period. So there may be hormonal changes that happen. There's a significant drop in estrogen and progesterone that happens in the postpartum period, and that might be contributing to some of the mental health symptoms that we see. The other factors are genetic history variables. So if you have a family history of anxiety disorders, you're likely at higher risk for anxiety yourself. And we think about environmental factors. So environmental stressors can kick on anxiety episodes in the postpartum period as well. So typically when we think of anxiety, we think of worry thoughts. So these are the what-if thoughts, the if-then thoughts, and noticing that those are intrusive and they're preoccupying. So it's not that you want to be thinking about these things, but you can't get them out of your mind. Very often with postnatal anxiety, the anxiety and worry centers around the health and safety of you as a parent or your loved ones or your baby. And these can be very, very scary thoughts that enter your mind and can feel difficult to control. The other piece of postnatal anxiety are physical symptoms. So these can be symptoms of feeling restless, anxious, on edge, increased heart rate, shortness of breath. Again, these can be very scary symptoms to experience in the postpartum period and may be indicative of an anxiety disorder. There's a great book actually called Good Moms Have Scary Thoughts. So a lot of women experience what are scary thoughts in the postpartum period. It's normal to have some worries about the health and safety of your child, but when they become intrusive and preoccupying, you can't get them out of your mind, or you notice that they start to affect your behavior. So for example, if you are worried your baby's going to stop breathing and you check to see that they're breathing every single hour, or if you're nervous that your baby is going to be harmed if anybody else takes care of them and you need to go to your doctor's appointment and you're sending 20 text messages in a row asking, is my baby okay? This could also look like extensive Google searching. So one of my favorite examples is if you notice a red mark on your baby's skin and your worry thoughts start spiraling and going, oh my gosh, what if it's cancer? What if it's an allergic reaction? What if it's blah, 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 blah? And you spend hours Google searching online, you're going to find yourself in a rabbit hole just maintaining your anxiety. And that can be one of those signs of postnatal anxiety. And so one of my favorite recommendations to postpartum women, if they're experiencing a lot of anxiety, is try to focus on just one or two trusted sources of information. So this could be, for example, your pediatrician or a favorite book that you have about parenting. And those are the two sources you're going to consult with rather than going down a whole Google search rabbit hole. One of the things to consider is that there are actually a variety of anxiety disorders we might consider. So you may want to talk with your provider to talk more about what are the exact symptoms you are experiencing. For example, you might be experiencing obsessive compulsive disorder or panic disorder or generalized anxiety disorder. So one of the first steps is really getting a little bit more clarity on the symptoms that you are experiencing before seeking treatment. But again, there are a variety of great treatments available for treating postnatal anxiety. The first line is usually therapy and or medication. So the evidence-based therapies available for postpartum anxiety include cognitive behavioral therapies, and these would focus on really identifying those maladaptive or unhelpful worry thoughts and helping you to retrain your thinking to be more realistic and focus on the present moment with your baby and actually be able to enjoy time with your baby rather than feeling so nervous and anxious and on edge. The other piece of cognitive behavior therapy typically focuses on relaxation training. So we want to reduce the physical tension and psychological arousal that is happening in your body. So again, you feel a little bit more in control of your body and more relaxed and calm as a parent. The other treatments available include medications, and it's important to consider whether or not you are breastfeeding when considering any medication and make sure that you are talking with your provider about any possible side effects of medication.